Welcome to Doula on the Down Low, a Christ-centered podcast for those navigating their conception journeys, their pregnancies, having their babies and raising beautiful children in Christ, and everything in between. We're so happy to have you. Welcome. Hello and welcome back, guys, to Doula on the Down Low. I know it's been a hot minute since I've been here talking to you guys, but I'm so excited to be back. Over the last couple weeks, I've had a lot of babies that I've been helping take care of. I have a sweet little 4-month-old girl, a 6-month-old girl, twins that are 8 months, and a sweet little 6-week-old that I've been kind of rotating in and out of, just making sure that these families feel supported, especially postpartum. And as any postpartum doula knows, the on-call life is crazy. But I am so glad that we are back here today and we get to talk all things hiring someone like me, hiring a doula. So today's episode is going to be about how to find a doula. What are the benefits? Do you even need one? Yes, you do. And what does that look like? The process of hiring a doula and, contracts, crazy stuff like that. And what an interview should look like with your initial consultation. So welcome back and let's get started. Before we move on, though, remember to like, subscribe, and ring that bell on YouTube. And if you're listening on Spotify, please be sure to give us that 5-star review just so we can keep making episodes like this and reaching more people, getting all the doula love across the community. Thank you so much. I appreciate it. If you're straight off the interwebs, or maybe you're a husband looking around for your wife, you might be asking, what the heck is a doula? I get this everywhere I go. People will ask, what do you do? And I say, I'm a doula. And they go, what's that? So totally typical. Don't even worry. This is such a common question. So we are a non-medical support person. So that means we're not delivering the baby. We're not doing IVs. We're not doing blood pressures or anything like that. We are solely there for the comfort of the mother. So what that looks like for a lot of doulas is making sure that you're holding space, making sure that questions are being answered during labor and delivery. If interventions are happening, kind of breaking those down, explaining to the parents what's happening. We do a lot of hands-on comfort measures as well. So alternative pain relief for parents that are trying to avoid medication or have a more physiological birth, which we'll have an episode on that. And just making sure that overall mom feels comfortable and confident, or at least as comfortable and confident as you can, especially as a first-time parent. And going from there, making sure that you're prepared, that all your questions were answered or they're being answered during labor and delivery. Just think about it as another set of hands during your birth, whether that's a home birth, it's a hospital birth, or it's a birth center. We're there in any setting just to make sure that you feel supported. Brief intermission to warn you about the cats. So if you see them running around, if you hear them, if you think there's explosions going on behind me, no worries, I'm safe. I just have 2 very opinionated, prissy cats, and they'll probably make themselves known throughout this episode. So apologies in advance. I am a crazy cat lady. But your question may be, why hire a doula at all? That sounds like an unnecessary expense. Why would I want more people in the delivery room? Great questions. And there's different answers depending on the couple. Every couple comes with a different set of values that they're bringing to the table. But most of the time, it's pretty similar in that they're looking for less interventions. In that they want a more natural physiological birth. And studies have shown that having another support person there, so somebody you trust, that can be your mom, your sister, your best friend, or a doula like me, just having them sitting in the room already drastically decreases your rates of having an epidural or a C-section. Great, wonderful, amazing, right? But imagine now that support person has seen birth. They have studied birth. They know the progression of events that happens in a typical birth or atypical birth. We have some doulas that specialize in high-risk pregnancy, VBACs, some C-section doulas even. So it's like having a walking encyclopedia there with you that's able to support you hands-on. We also help with hands-on support. So alternative pain measures, helping you get into the bathtub to get that relief, or the shower, doing a double hip squeeze to open up your hips, holding you so that you're able to get into a squatting position. Done all of it, been there, it's amazing. And that really does help lower the rates of having to be induced, get an epidural or C-section, because you're using your body's physiology to have the baby naturally as we would have for millennia. We also see more birth satisfaction. So when women look back at their births, it is less traumatic and they feel more joy and presence in that birth because their emotions and spirituality were taken care of, as well as the physical aspects of their birth. It's continuous support. So doulas will usually be there for a very long period of time. Some of us do take breaks. Like I have a 12-hour window where after 12 hours, I will go home. I will rest for a few hours. I will eat so I can come back and make sure that you are supported in the best way possible. Sometimes a backup doula will come in and take over those windows. It really just depends on the agency you're working with or the individual doula. And it's also able to give your partner a break too. So if your partner just needs a breather, needs a nap, needs to get something to eat for you quick, you have somebody else there that you know, that you trust, that's able to fill in that role. And of course, advocacy guidance. We know what's typical, we know it's atypical most of the time. And so we're able to kind of guide you in different things. So what I see commonly is labor will stall, which I hate that word, stall. But labor will slow down, right? And they'll start to suggest Pitocin. Oh, you've been really working hard for a long time. You look tired. Let's get you an epidural. So for me, what that would look like, if I know you don't want an intervention or you've stated in your birth plan, I don't want an epidural, that's when we sit down and have a conversation. So do you want to try other interventions? Do you want to switch a birthing position? Do you want to sit up more? Do you want to get on all fours? And if you're truly tired and this is really what you want, we'll sit down and be like, okay, cool. Let's move forward with the epidural. I know it wasn't in your birth plan, but I support you wholeheartedly. Let's make sure you're the most comfortable possible. And that's when we start to talk about comfortability, or, hey, let's see how we can make this the birth you wanted still and make you happy and make sure that you're comfortable despite not following the birth plan, which never marry a birth plan. Things happen. Doulas don't guarantee outcomes, which we're also going to go into later. What's important is that you feel safe, that you feel comfortable, and you feel that your voice is being heard even amongst the chaos. So now that you're convinced and you totally want a doula, you're probably wondering, how soon can I find one? I want that support ASAP. And this can be very different for different people. Once again, I've had moms pee on a stick and call me immediately, and I celebrate with them and I go, all the good stuff. Or on the flip end, I've had moms contact me at 37 weeks in labor. Maddie, do you have a spare hour or two today? Totally cool. We support both. However, we do recommend start looking at the second trimester mark. A lot of doulas won't sign a contract before your second trimester. This is multifaceted, and mainly because a lot can change in the first couple weeks of your pregnancy. So your provider can change, where you want to give birth. We're close to a military community, so some moms may PCS out of the blue. Happens all the time. So ideally, second trimester. And you might be asking, well, Maddie, why can't I hire you just like 2 weeks before my due date? You can. However, we're going to have some catching up to do. The majority of doulas and doula packages come with 2 to 3 prenatals. So that means we meet before your due date and we kind of discuss what your birth is going to look like and how we can achieve that. So we're creating a birth plan. We are trying out different birthing positions. We're going over your backup plan. What are some alternatives we can do? Are we open to the epidural? Are we not? Are we open to a C-section? Are we not? And all these things are discussed within an hour or two prenatals that you have 2 or 3 times throughout your pregnancy. So you can imagine if you call me and you're in labor, there's not much catching up to do. And it's super important because the uterus is a muscle. Everything down there is a muscle. It contracts, right? It opens, it contracts. That's how your baby comes out. So imagine you are a weightlifter. We'll just use arbitrary weightlifter. And you have not picked up weights in 6 months. Actually, you've picked up weights never in your life. and you go to this competition, I doubt you'll be able to bench press 200. Sure, there's some D1 athletes out there who just show up, boop, boop, can do it. I bet that's how Dwayne The Rock Johnson was born. He came out the womb, you know. But the majority of us will not be able to just show up and have a physiological birth. In times past, in millennia past, we were very accustomed to birth. We would go into the community, women especially, not so much men, but young girls would see their mothers give birth to their siblings. As you became older, you would help your friends give birth. And even older, you're helping your daughters, your granddaughters, your community members, because it's a very common bonding exercise for women. It's something that we do. It is a rite of passage in a lot of communities, and it's super important and integral to who we are. So, with that being said, this is prep for you. This is preparing you for a physiological labor. You're not just going to show up and bench press those 200 pounds. You need a little bit of practice. So we give you those exercises. We give you the Miles circuit, for instance, or we let you borrow our Reboso to practice with your partner. And then you're able to get into the motion so that you're able to remember these things and feel these things and have an intuition about your movements while you're giving birth. And this is especially important for, of course, first-time moms. You've never given birth before. Your muscle memory isn't there. But it's also important for women who've had C-sections. You haven't vaginally given birth before. Your body doesn't remember doing that. This also goes for a lot of inductions. With that Pitocin, your body hasn't naturally pushed itself into labor before. And this can go for so many other interventions like the epidural. This could go for birth trauma. Sometimes your body will block out those memories if it was too traumatic. And that means your body doesn't remember giving birth at all. You don't have that muscle memory. So it's really important that we start soon. We can start breaking down those barriers, and we can really start prepping you mentally and physically for that birth you want. So now you know that you want a doula. You know the timeline and when to look for a doula, but where are they? So you probably found me on the good old-fashioned internet, which is an amazing resource. You can go into Google and doula near me, or YouTube like I am here, Spotify, Facebook, great avenues, great ways to do it. Some other ways listed here, there's doula directories. So if you have a doula agency in mind, or I don't know, maybe you're a certified doula and have a certification preference, they have directories. They'll list, these are all our certified doulas in Austin, in Huntsville, in Dallas, right? They're great and all, but I think there's other avenues. Directories are not my favorite. I like just word of mouth networking, because those are people that have actually met this person and can vouch for them. Local parenting groups are a great way to ask. So on Facebook, any mommy groups you're in, maybe in person, you go to a coffee hour, maybe your church group, just ask like, hey, did you have a doula? What did that look like? Who did you hire? Kind of asking around maybe what their experience was with that doula and with a doula in general, and if they recommend doulas. And I think that's a really great way to gauge where you are and the kind of doula you want to hire. Sometimes OBs will have recommendations, less so than midwives, though. Midwives tend to be a lot more open to working with doulas, not saying that OBs aren't. I just think because they come from that natural birth sphere, they're a lot more accustomed to working with doulas. And in my area specifically, we've unfortunately had doulas who go into the hospitals and tend to cause a bit of a ruckus. So some OBs are a little more hesitant towards working with doulas. And I think what a good idea is, this is for both doulas and for expectant parents. If you have an ultrasound coming up, or you just want to chat with your doctor and you feel like you want a little bit of extra support, feel free to invite your doula. You can even just ask your OB how they feel about doulas, and that way they can bridge that connection and get to know each other before the birth. And that way they're a little more comfortable, they're aware, and it's not catching them by surprise. Another good place to find doulas is community organizations. So we have Giving Austin Labor Support here in Austin. I think Rocket City Doulas out in Huntsville. If I'm correct, Amina will have to correct me, or you can correct me in the comments. And these are community organizations. Sometimes they're just public agencies where they have multiple doulas. It's a collaboration. Other times, there are community support. So, like Gals Giving Austin Labor Support, they try to cheapen it for other people and help with the cost. That way, it's more accessible to people, especially low income people. So, I would just look around and see kind of what your options are. What's the birth environment like? I mean, there's hundreds of doulas here in Austin, but there's maybe like 5 to 10 in Huntsville where Amina is. So it just really depends on your area. And if you don't find one locally, you could always look at virtual support. So what that would look like too is you get the prenatals virtually. We could do it on Zoom, phone call, and this is other doulas do this as well. And we kind of chat, and then during your birth, I'm on FaceTime or on a phone call, and you can just call me whenever and I support you that way. And a lot of doulas do that for people who are in more rural settings because I think it's going to be a lot harder to find a doula in, let's say, middle of nowhere Montana compared to a very metropolis centralized city like Austin. So just look around. And if you need help finding a doula, feel free to DM me and I will ask my doula friends and find you someone close to you. So now that you've found your doula or you're interviewing multiple doulas, you fill out the information, you send them an email, you've got a time frame. Cool. Now we're going to sit down and chat with this doula and get to know her and see if we're a good fit. So this is super important because this is somebody who's going to be supporting you throughout your pregnancy, at your labor, and most of the times postpartum. So it's really important that you trust this person wholeheartedly and that you feel really connected. So let's go into this and see how we can find you the best fit. So first of all, here are some common mistakes that I see. And it's not even really a mistake. It's just questions that are rooted in misconceptions, I would say. Because a lot of times we find ourselves just surface level questions is what we tend to ask. And that's okay. You don't know what you don't know. Especially in the doula realm, unless you've been in it for a while, it can be pretty confusing. So some questions that I would kind of stay away from, unless you're super curious, which is fine, are things like how many births have you attended? So this isn't truly a gauge, in my opinion, because different settings allow for different people to do different things. So, like me, for instance, I was a nurse aide in labor and delivery, and then I became a doula, and then I became a midwifery assistant. So I've seen a lot more birth, right? I've seen about 200 births now, maybe a little more and some change. Whereas Amina, per se, she's my doula buddy out in Huntsville, she's seen 50. But if I had to tell you who's more experienced, let's say, I would probably say Amina. She's given birth before and she talks to more mommy friends, and that's just the season of life she was in. Now, that doesn't necessarily mean that because your doula didn't give birth, she's not a good doula either, which is another common misconception. I have met so many doctors, men specifically, but doctors in general, nurses, doulas, midwives who've never given birth before, but they are perfect. They are knowledgeable. They bring a great aura to the table where they're calming, where they're nurturing, where you feel supported. And that's kind of the crux of what I'm getting at. Experience is important. Knowledge is important. But I think what's more so important is, do you see this person comforting you at your birth? Is that the person you want there? Do you like their methodology? Do you like their modality? Another question I see that falls into this category is, where did you train? And this is also a little for me because I trained initially with an agency that I no longer align myself with. The doctrine they were teaching and kind of their worldview doesn't really align with me. It didn't align with me then, and it surely doesn't align with me now. But I felt this need to certify with one of the bigger doula certifying bodies, which for a new doula makes sense. I didn't know what was happening. But looking back, doulas aren't regulated. It's not like nursing where you have to pass a board of nursing, or a doctor where you take your board exams, any professional career, right? Although doulas are professional and it is a career, we're not a regulated entity. So basically, anybody can technically call themselves a doula. So, what matters more to me personally than somebody who's certified and somebody who trained under this, that, and the other is, do they feel confident in their training and maybe who their trainer was? Like for me, shout out, Tracy Donegan was my trainer. She's amazing. She pioneered the gentle birth method. She's into red light therapy, which I'm a huge fan of, and she does a lot of concierge work. And she was one of the first doulas in Ireland. So I loved her more than I loved the agency and the board she was certifying me through. And that's really where doulas feel a lot of connection, is that ancestral wisdom that's really passed down to us. And that's more so what I would ask about as a parent. I say, what's your methodology? Who did you learn it from? And I will wholeheartedly tell you, oh, my trainer, Tracy. And she did this and she did that. And I take this with me and I use it in my own practice. And that way you can kind of get a window into not only your doula's personality, but how they practice. And like I said, same thing. Are you certified? Doesn't really matter. Most people can call themselves a doula, and doula means different things to different people. Once again, different things, different people. Maddie, you keep saying that. I know, but it is really that subjective. Who you are and who your doula is changes. Like, different folks, different strokes. With that being said, though, just make sure that your doula is somebody who you think is a good fit, is what I would tell you. Is it someone you trust? Is it someone that holds space for you? And do you feel safe and comfortable with them? So feel free to ask those deeper questions to your doula. If she's offended that you're going deep and asking very specific questions, then she's probably not the doula for you. Sorry, my cats have an opinion on this too. This is important. But for me, what this looks like, if I was interviewing a doula, one of the biggest things I'd say are, what was the scariest birth you've been in? What did that look like? How did you support the parents? What does an ideal birth look like to you? What sets you apart from other doulas? This one's super important too, because usually what sets a doula apart from other doulas is her niche. So some doulas are specifically VBAC focused. Others love supporting epidurals and C-sections and intervention births. Some are like me, where it's really your choice. I'll support you wherever you go. And then of course there's some that'll die on that hill and be like, no intervention whatsoever. And there's always a place for that. It just really depends what you're shooting for and what experience you want. Some doulas come from military families like me, and we're really keen on supporting military and first responders. Or you're a Christian doula like me and you serve other followers in Christ. Maybe you're BIPOC and you celebrate and support other people of color. Maybe you're Native and, or Indigenous, and that's the people you serve. Maybe you're queer, LGBTQ plus. You know, uh, there are a lot of different doulas out there. So if that's something you're hyper specifically looking for, I would definitely ask and make those expectations clear from the get-go if there's something you're really, really looking for. And that's also a good sign of a doula, which is almost counterintuitive. But if she's able to tell you that you're not a good fit for each other and suggest that you go to somebody else, this shows maturity and professionalism. And honestly, I would keep that doula in the back of your mind for other people, like your friends or your family that might fall into that category of whoever they serve, and support them right back, because honestly, that's tough for a doula to do, to give up clients, but to know that they're in better hands with somebody else. And I love that maturity, professionalism, the abundance mindset. We need more people like that. Ooh, red flags. This is some of these set off my doula ick alarm, so that's why I put a big red flag right there. We can't guarantee birth outcomes. So if a doula, let's say, tells you, oh yeah, we're gonna get you that VBAC, and it's like in their contract or something like that, I would steer clear. We can't guarantee anything, birth is out of our control, which is also what makes it so scary and why you should probably have a doula. But we don't guarantee anything. Things change with the drop of a hat, and guaranteeing it is just wrong, and it leads clients astray. It makes them believe in a false hope sometimes, and it's just not fair. So if your doula is guaranteeing stuff, I would go ahead and really reconsider. Giving medical advice. Now, this can go either way. So as long as the doula remains in her scope of practice and isn't telling you specifically to do one thing or another, but is providing you unbiased, let's say, studies or information. A big one, let's say, is vaccines. I have people ask about vaccines all the time. I will neither approve nor disapprove of vaccines. You will never know my opinion about vaccines. What I can do is give you the pros, the cons, make you read the vaccine book, per se. Maybe you watch Shot in the Dark on Parler. But I will give you resources. I will give you the pros and the cons, and that's for you to decide. I will never tell you that a C-section is bad or good or necessary or unnecessary. Same with any other intervention, because that's not my place. I'm not your doctor. Even being a midwifery student and a midwifery assistant, that's not my scope when I'm with you. My scope is to be your doula and to give you unbiased support. So that's what that's going to look like. Now, if something happens in the delivery room and you're like, oh my God, what are those forceps for? I can sit down and be like, well, they're probably trying to do a forceps birth, and sit you down and walk you through that. The key is that I'm not telling you what to do and what not to do. I'm just giving you the information so that you can make that decision for yourself. That is called informed consent, and you have a right to it, by the way. And if you're not receiving that, please call a patient advocate. That's a problem. But yeah, no, your doula should never be giving you a medical opinion, is probably a better way of putting it. Lack of boundaries. So for me, what this looks like when I see a doula who is giving maybe too many details about their personal life, let's say, they're not keeping it professional, because there's a difference. Although I do want to be your friend, and I do want to support you in that capacity, there's a huge difference between me going out with my girlfriends and having a cup of coffee and, I don't know, trash talking the boys on dating apps versus you, my client, who I'm trying to get to have a successful birth. So just look out for professionalism, unless you're not looking for a clutching pearls doula like me, and maybe you want somebody that's more like, hey dude, hey bro, especially in the Austin area. That's totally fine, but that is definitely something to consider and to trust your intuition on when you're talking to different people. This one's a big one. Discomfort with your birth preferences. So why would you hire a doula that doesn't support what birth you're choosing? And I especially don't like it when doulas have an opinion on the birth you're choosing. A great example. There's a doula and you call her and you're like, hey, I'm having a C-section, but I still want that support in triage and after I get out. Need some help with breastfeeding afterwards, and I'd love some support when I get home. And then your doula, or the doula you're interviewing, lists off all the reasons you shouldn't have a C-section. That's not cool. All unsolicited advice is rude. And honestly, I wouldn't want to have somebody like that at my birth, because it feels like everything I do is going to be wrong to them. And then I'm just walking on eggshells the entire experience, and it's adding more anxiety. So back to the in-depth questions. What's your modality? What births do you usually attend? Do you like these births? How do you support these people? How do you support when things go a different direction than initially planned? Questions like that. More sketchy stuff to discuss. So a lot of doulas don't put their pricing on their website. That's totally fine. They have a right to privacy, and talking to you about that during your consultation. Some doulas are very upfront about their pricing. It's all over their website, this, that, and the other. What I would find sketchy if they're not mentioning it at all. And then after the consultation, you're sitting there like, oh my gosh, I like her. Oh man, do we have the budget for her? She never told me her pricing. So if the doula doesn't bring up pricing and you haven't seen anything yet, I would go ahead and mention that in the consultation, because some doulas can be pretty pricey. And of course, it usually comes with years of experience, professionalism, certifications, education. True. But you still want to make sure that you're able to afford your dream doula and it's not going to cost you, I don't know, $10,000 for her to show up to your birth. Some doulas offer sliding scale options. So if you're not initially able to um, afford it, there's pay what you can programs for a lot of doulas, or what we do is payment plans. And there's also community doulas. So like I was talking about gals, I'll have to have them on the channel sometime. They help underprivileged women and women with financial struggles afford doulas. That's why it's called Giving Us Labor Support. So cool stuff like that. So, and if you have questions about pricing, message me. I'll walk you through it. If you're a doula that has questions, ask me. I'll put you in the right direction. And obviously, feel free to call your doula. And if she's still being shady about it, don't hire a shady doula. And like I've been screaming this whole episode, your compatibility matters. Do you feel comfortable? If she gives you the heebie jeebies or the ick, don't hire her. Do they listen to you? So is your doula actively listening and holding the space for you, or are they just waiting for their turn to talk? I have ADHD, so sometimes that's really hard for me. I'm like, woo, woo, woo. There's so many things I want to mention. But I have to ground myself and be intentional with people so I can get what they're trying to tell me and I can help them to the fullest capacity because I'm fully understanding what they're trying to tell me or ask of me. So is your doula doing that? Does your doula know how to, for a couple minutes, and listen to you wholly and not just wait for their turn to talk? Do they respect your vision? Are they like, ooh, I can't do that? Do they give you icky faces when you mention something? Or are they smiling? Are they supportive? Are they, oh, yeah, I love that for you? And really thinking of ways to support you the way you want. And does your partner feel supported? This is a big one. Do you think that your doula and your partner could vibe? Because they're probably going to be in the same room for about 12 hours. If they don't vibe, you're going to have a very uncomfortable birth. And your doula is also supporting your partner. I mean, not to the extent that they're supporting you, but they're still being that communicator. Because dads, unless they're in the medical field, and even then, birth is kind of a taboo for most men, they probably don't know what's going on most of the time. So being able to sit down with your doula and he feels comfortable enough to ask her questions, or go to the bathroom and trust her there, or go get ice chips for you and she's there supporting you, that's pretty important in my opinion. Cool. You found your dream doula. She supports your partner. She loves your plan. Now you get to the doula contract. So every doula should sign a contract with you. It's a legally binding agreement. It protects you and her in case of money management issues, something's up with the birth, something doesn't go the way you wanted, or maybe you had a very quick labor, the doula wasn't able to make it, maybe she needs a backup doula. This is all going to be included in the contract. So I would ask questions like, I bought this package. What services are provided? Make sure those services are in the contract. What is the on-call period? For different doulas, it means different things. And for me, different clients mean different things. So for a first-time mom, I'm probably going to be on call from week 38 until she gives birth. Second or third time moms, if I know they gave birth at 36 weeks, once or twice, I'm going to be like, oh, I should probably be on call starting at 36 weeks. So it really depends on the client for me, and other doulas have different modalities and just preferences when being on call. And what I see the most is around 37, 38 weeks. Backup doula. Does she have a backup doula? Have you met the backup doula? Are you comfortable with the backup doula? I let my clients meet my backup doulas before they sign a contract with me, just in case they feel comfortable with both of us, because it is kind of a team sport. And making sure that when my client signs the contract, they have all her information too, and she's usually signing. Usually. There are cases in between, and weird stuff happens sometimes, but I would definitely make sure that you know the backup doula. Payment terms, this is very important. Does she expect everything up front at 38 weeks? Are you able to do payment plans after the baby's born? This, that, and the other. Different doulas have different payment dates. It really depends, and it's definitely something you need to discuss. Communication expectations is another one. So for me personally, when you're pregnant and you are not anywhere close to giving birth, you can contact me via text or phone call during normal business hours, Monday through Friday. Obviously, if it's an emergency, call me and I'll pick up. My phone is always on. But that's just a preference. And I usually won't text back if it's not an emergency and it's like 8 o'clock at night and I'm sitting down watching Secret Lives of Mormon Wives with popcorn, right? I'm probably not going to answer until tomorrow. But other doulas have other boundaries. Totally cool. Some will text you immediately. Some won't text for 2 to 3 business days. It just depends, and that's usually going to be in their contract. And then, of course, when the on-call period comes, call, text, middle of the night, 4 a.m., I don't care, whatever, I'll get you that Chick-fil-A. It just really depends. Different folks, different strokes, once again, which is why it's super important that you ask these questions so that those expectations are handled. So you've researched your doulas, you've done the interviews, and now it's down to making that final decision. Who's going to be my doula? Who's going to support me? A really big thing is trusting your intuition. I think women have incredible intuition and are able to read people very, very well. So stick with your gut. Probably the first person that comes to mind is the right person. Compare notes with your partner. So sit down and be like, hey, my partner's name is Casey. Hey, Casey, what did you think about Amina as our birth doula? And he's gonna be like, wow, I really liked her. I think we really connected. I'm like, oh, cool. I really connected with her. I think she's the right choice. Awesome. But I also talked to Belinda. How do you feel about Belinda? I didn't really connect with her. And he's like, cool, then let's go with Amina. So you're able to have those bounce backing conversations and see who you both feel the most comfortable with. Because although it's your birth, your partner's probably going to need a little support too. And feel free to text or call that doula with any other questions. Maybe a question comes up later. I love just giving you guys my personal number and be like, call me, text me. I don't care. Leave the voicemails, leave me emails, Instagram messages. I don't care. I'm here to help you with any lingering questions. And your doula should be pretty excited to answer those questions for you because that shows that she's invested in you, even if you haven't given her a dime yet, which shows how much she cares, in my opinion. If they're able to take the time and I wouldn't say not be selfish because there is a time and a place for boundaries, but can graciously give their time to you, I think you know that they're pretty invested in you. And so my final tips for the interview section or even just finding a doula is to interview multiple doulas if you can. I know this is hard in some rural areas, but just get a feel for who's out there. The first doula you talk to might not be your dream doula. And if she is, interviewing other doulas will solidify that for you. Clarify your expectations early. So, Maddie, this is my second baby. I'm having a vaginal birth. I want it to be physiological. I don't want an induction. Cool, awesome. Been there, done that. Here are all the resources I've got for you, putting you in our Google Classroom and making sure that our prenatals are exactly what you need to prepare for that. And of course, keep communication open. This is super important. I like doing weekly check-ins, whether it's my clients texting me or I text them, and even a newsletter, the Google Classroom. I do updates every so often, just keeping in the loop with that. And of course, if you have any final questions, you're more than welcome to text me, to message me, to comment below, and I will try my best to answer them all. Thank you for sticking around to the end of the episode. It was so nice chatting with you guys after nearly 3 weeks of no videos. I feel like the world's worst podcaster, but I'm so excited that we're here. Remember to like, subscribe, ring the bell, and leave a review if you're on Spotify so that we're able to make more episodes and host more people. Just good reviews flowing, hitting those algorithms, and making sure we can support you in the best way possible. Stay tuned for future videos. We will soon be starting Austin Birth Talks, where we have different professionals coming onto our podcast to chat with you guys about the services that are available in the area. And later on, Huntsville Birth Talks as well for all you in Alabama. I'm so excited that you're here. Thank you so much for your time and have a wonderful day.